next, we've got appendicular skeleton. So these are the bones of the appendages and the bones that attach the appendages to that axial skeleton. So when we look at it, we've got two different girdles, if you will. Even guys have girdles in this case. We've got the pectoral girdle, right? You think of your pecs. So the pectoral girdle attaches the upper limbs to the axial skeleton, to the trunk. And then we have the pelvic girdle, right? The pelvis down below, attach the lower limbs to the trunk. So pectoral girdle is going to be clavicles and the scapula. So it has a lot of mobility there. And when we look at it, we can see that they're very specialized bones, to be sure.
The pectoral girdle refers to the bony arch formed by the clavicle and the scapula. The primary function of the pectoral girdle is to act as an attachment point for the muscles that provide arm movement at the shoulder joint. It also provides the only connection between the arm and the axial skeleton.
Well, it's cool to see the movie. I think I'm a little bit more dynamic than that guy, at least I hope. Okay. So in any case, now we can see it. We can see how here's our humerus, right? So our humerus here is going to be coming up and attaching to our girdle, right? So our girdle is going to be the scapula on the anterior side. On the posterior side, like we see here. And then the clavicle on the anterior side. So here we go. Scapula. Big triangle that we see right there. All right, so let's take a look at these two bones. So starting with the easier one, clavicle. So you used to call it the collarbone, now you gotta call it the clavicle. And not too difficult, a little bit like the rib, small S-shaped bone. Now notice we have two ends to it. So we've got an acromial end, and it is named, so remember we have a acromial region, and there's actually the acromion is of the scapula. So the acromial end is where the clavicle is going to form an articulation with the scapula. Then we have the opposite end, which is going to be the sternal end. And you can imagine, right, that's where it attaches here, more medially to the sternum. So we need to know the different ends. The sternal end tends to be, if you see it along the axis of the bone, tends to be a bit rounder and thicker, and the acromial end is a bit flatter. You'll also notice that there's this here. This is called the conoid tubercle. Remember when we were talking about the mandible, we were looking at, there's a coracoid, or the coronoid processes there. So conoid is a little bit different. So watch your spelling there. But that tubercle that we see there is right underneath on the inferior surface. So you should be able to see that little bump right there called the conoid tubercle. Now when we get to the clavicle, it's a little bit more complex, triangularly shaped bone, and the vertebral column is actually located over here. So this is going to be the medial side over here, the medial border. So that means this side is the lateral border, and then up here is going to be the superior border. It's a triangle, only has three sides. Now what we're seeing is we are looking at the anterior aspect. So as if you're looking through my body on this side, since it's right, and you're looking at that surface of it deep in there. So this is called then the subscapular fossa, shallow depression. We can also see the glenoid cavity. This is where the head of the humerus makes its articulation. Here's the acromion, like we mentioned here. That's where the acromial end of the scapula attaches. We also have a different extension here called the coracoid process. Oh, not another one. Coracoid here with the scapula, conoid here with the clavicle, and then coronoid associated with the mandible. Ugh. Take your time. Anyway, so anterior aspect. Looks at the posterior aspect. We see the same different borders. The medial border is also called the vertebral border, if you like that instead. We can see acromion. The acromion is a kind of extension of the spine of the scapula. So here is the spine of the scapula right through here. You can palpate it, right? So there's the spine of the scapula. The acromion is going to be over here where it articulates with the clavicle. You also see a couple of fossa there. So you have the supraspinous fossa and the infraspinous fossa. But look at the name. Superior to the spine dip. inferior to the spine dip, right? So it's all in the name. Here you're seeing it from a lateral view. So again, this right here, glenoid cavity, is some kind called the glenoid fossa. It's a depression where the head of the humerus goes. Not very deep, as you can imagine, so you get a lot of mobility there, but not a lot of support necessarily. So you rely on like rotator cuff muscles and tendons and ligaments to hold it into place. But it is possible to dislocate it. So you can see this aspect of it here. It's a very unique bone, to be sure. Sometimes also you will find that you'll have to identify the supraglenoid tubercle, this little bump on top, and the infraglenoid tubercle, this little bump on the bottom. Why do we need to know bumps as projections? Oftentimes tendons come down and attach to them. You're going to see that when we get to the muscular system. Okay. So working our way at the upper limb, 30 bones that we find in the upper limb, right? Starting with 1. Now remember, upper limb, we have an arm and a forearm and then a hand, right? The arm is not this whole thing here. Arm is between shoulder and elbow. Forearm is between elbow and wrist, okay? So 1 bone of the arm, which is the humerus, 2 bones of the forearm, the radius and the ulna. 8 bones in the wrist called carpal bones, then 5 metacarpal bones here of the hand, and then 14 phalanges. You look at 14, you're like, 1, 2, 3, 4, 5, divided by times 2, 10. No. Each of these has 3 bones, except for the thumb, which only has 2. We'll see that coming up. Okay, humerus. What is this? This is the funny bone. Now, just an aside, when they talk about hitting your funny bone, right, really what you're doing is you're hitting your elbow along here. There's a nerve right through here that's called the ulnar nerve, and that's actually what you're hitting. You can actually even touch it like this. If you give it a good touch like that, you can actually feel like wing, a little electrical activity going down to your pinky, which is the root of it. So they call it the funny bone because it's near the humerus, right? That's where the name comes from, but you're actually hitting a nerve right there. But aspects of the humerus, we have the head of the humerus that articulates with the scapula. You can see that with a head, we then have a neck where it narrows down. So it's interesting though, we have what's called the anatomical neck, which is right here, and the surgical neck is a little bit lower, inferior to that. We also have a couple of bumps. You can see that there's a greater tubercle up here, and there's a lesser tubercle here on the anterior side. So greater is above and lesser is below, or superior and inferior. So when we get to the shaft, we have right here what's called the deltoid tuberosity. This is where the deltoid muscle inserts. And at the distal end, what we have are some very unique extensions of the bone. We can see that we've got 2 projections that basically face inferiorly, and then 2 that extend laterally, right? So this one here is called the capitulum, and this one here, which is a little bit sharper, it's called the trochlea. Now notice, here's the thing, right? We talked about oftentimes you have 2 of those bones. You got a left humerus and a right humerus. On an articulated skeleton, easy to go, oh, I see, that's the left. But on the lab practical, we will just be giving you 1 bone, and you will have to tell whether it's left or right. In order to tell whether something is left or right, you need 2 things. You need something that tells you anterior, posterior, and you need something that tells you medial and lateral, okay? So we know, for instance, with the humerus, what we're going to have is we've got a head that's always going to be facing medially, right, to form an articulation with the scapula. So if you can orient the head, we know that's proximal, and they face in, medial. Now, how do we tell anterior, posterior? Well, what we find is that the trochlea and the capitulum, mostly we can see here on the anterior side, and there's a shallow depression right here that's called the coronoid fossa. There's one of those words again. But on the posterior side, look at this. We got a much deeper fossa here. That's called the olecranon fossa. So the olecranon fossa is a deeper depression that's on the distal end, and that's always on the posterior side. So if you're looking at that bone, you find the head, face it medially. You find that olecranon fossa, you put it posteriorly, and you can figure out whether it's a left or a right. Okay. Other things that we can see. So we had 2 structures, projections pointing down, trochlea that we see across here, and the capitulum, which is a little bit more rounded, easier to see on the anterior side. We also have projections extending laterally. These are called epicondyles. One on the inside called the medial, one on the outside that's called the lateral. Okay. Okay. So here's the elbow joint. We can see how the humerus contributes to it right there. And we can see how the radius and the ulna form an articulation with the humerus there. Now this is the posterior side over here. And we can see that your elbow, that big bony thing right there, is mainly coming from the olecranon process here of the ulna. So the olecranon process goes into the olecranon fossa of the humerus. That's where the names match up. Okay? Okay, so we get to the forearm, two bones. We said there's a radius and an ulna. So what we find is that the ulna tends to contribute more towards the elbow, and the radius tends to contribute more towards the wrist. The ulna is on the medial side, like we see here, and the radius is always going to be on the thumb side, the lateral side, like we see there. And there's this interosseous membrane that occurs between them, like you see here. Okay? So this is, again, more proximal. This is up at the elbow right here. And here you can see that olecranon, or olecranon process right there that we talked about. We can see there's a trochlear notch. It's kind of a C shape, or better still, it's a U shape. And if you can find that U-shaped trochlear notch, you know you're looking at the ulna, which also starts with a U, if it's just sitting by itself. And at the other tip of this C-shaped notch, what we get here is called the coronoid process. So the coronoid process goes into the coronoid fossa. The olecranon process goes into the olecranon fossa. Okay, what else can we see here with the ulna? At the distal end of the ulna, there's a little point down here that's called the styloid process of the ulna. So that comes down and extends right here. See that little bump? That's the styloid process of the ulna right there. There's also a styloid process of the radius right here. So it's very important that when you identify these, like on a lab practical or something like that, you don't just say styloid process, because we know there's a styloid process here, and here, and here. So you have to say styloid process of the radius, of the ulna, etc. So the radius itself, we have that radial styloid process, and then here towards the elbow, we have a bump that's called the radial tuberosity, and we have an expanded area called the head, and a narrow section underneath it, which is called the neck. There is that C or U shape of the trochlear notch of the ulna, with the olecranon process here and the coronoid process there. You also have a little depression here called the radial notch, and that's where, as you can imagine, the head of the radius is going to be forming an articulation with it. So it's going to set right in there, right there. Now here's something associated with the radius and the ulna that maybe some of you have unfortunately experienced. A Colles fracture. A Colles fracture is where we have the distal end of the radius that breaks as you're falling off your skateboard or something like that. You put your hands out, that compression can actually break your radius, and so that has a specific name called a Colles fracture. Okay, so we get out to the hand. So let's get to a figure here where we can see what we're talking about. So here are our hands, left and right. Okay, so first off we start with the wrist. And there are these bones that we see here of the wrist. And these are collectively called the carpals. So when we look at the carpals, we have two rows. 1, 2, 3, 4 bones in the proximal row. 1, 2, 3, 4 bones in the distal row. So 4 and 4. And so they all have their own names: scaphoid, lunate, triquitrum, and pisiform. Pisiform is the smallest one that we see over here. And then trapezium, trapezoid, capitate, and hamate. So if you use this phrase, some lovers try positions that they can't handle, then that gives you the first letter of all 8 of your carpal bones in order from proximal to distal. Okay? So we can see them there. Now, when we get to the bones of the hand, when you look at it here with no skin on it, you might think, oh, this is part of the finger here. but these are the bones of the hand. So these are called the metacarpals. And they're numbered from the thumb 1, 2, 3, 4, 5. That's it. First metacarpal, second metacarpal, etc. Easy. But when you get to the phalanges, the numbering also is retained. But notice we have different bones there, right? So here is the first phalanx, which is the thumb, and there are only 2 bones. So there's a distal, number 1, phalanx, and there's a proximal that we see there. When we get to the other ones, 2, 3, 4, 5, we can see that there are 3 bones. A distal, and a proximal, and a middle. So it's a numbering system as well as a position. Now one other thing, when we mentioned carpals like we saw there, that may have reminded you of something that you've heard of called carpal tunnel syndrome. So there's a band of connective tissue that goes right across here where we have tendons going through and we have nerves going through and blood vessels, etc. And if these tendons here or these ligaments here get inflamed, right, if there's inflammation there, then it impinges on everything passing through it and gets much smaller. You can see it in these diagrams here, right? So there's a natural passageway through here, and here down below is when it gets compressed. So if it gets compressed, there's a median nerve that goes right through here and then branches out. You can get nerve pain associated with it. Okay, so those are the bones of the upper appendage, right, as well as the pectoral girdle. Then we'll move on to the pelvic girdle and the lower appendage as well.